the next important thing I will like to talk about the consultation here. And look, you have to put them together. I'm giving you the recipe where you have to be mindful of how you are going to use that in the clinical practice. What I will like to do in my future videos is I will like to probably run you through a recording of a consultation that I've done on a live patient. That might help you as well. I will obviously gain consent from the patient for that. But at this stage, what I'm trying to do is I'm giving you the important things that you do need to remember and bear in mind while you're going through the consultation. Now, please remember that the reason why I'm going in greater details on each one here is that the more you have talked about it, the more you have thought about it, believe me, when the time comes, you will remember that. And even if you have not remembered it at that time, you will later on realize, if you go on to assess your consultations or assess your discussions, you will realize that, okay, this is why this was discussed, and you will be more careful about that later on. Okay, so continuing on, here what we are talking about is prolonging the consultation. Now look, when you are talking, and this is mainly relevant for patients needing comprehensive care, for patients needing a lot of treatment in their mouth. Now, no one likes to be hearing that, oh, you have got a mouth full of cavity, you need all your teeth taken out, you need a mouth full of implants. It is always a big shock. It is a biological shock to them because now they think of all the pain and all the discomfort that they have to go through. It is a financial cost to them, obviously, because dentistry, as we all know, is quite expensive. And it is also an emotional cost to them because now they have to think about, oh my God, I have to live without the teeth, or I have to go through these things. And so you have to be very mindful of these things. And what that brings us, and this is really important and very relevant, is about the 5 stages of grief that I have mentioned here. Okay, so just think of it this way. If you've ever done a consultation, like a long consultation, you will be able to relate to this really well. Is that especially we are talking about, please remember that we are talking about difficult patient here. We are not talking about the easy and the wanting patients. We are mainly talking about the difficult patient who will need the treatment. Now, what happens is when you actually tell them that there is a mouthful of cavity and there is a mouthful of issues in there, then the first thing that they think in their mind, even if they don't say it, some even say it out loud, or some actually, the first thing that comes to their mind is, no, that's not right. Okay, I don't think so. I need that much work in the mouth. And that is the first thought that comes to their mind, unless they are already had a consultation somewhere else or someone's already told them about that. Now, so that is something that is very important to understand, that the first stage is always the denial. The next step that we all have faced in a dental clinic is anger, where the patient gets frustrated, where the patient gets upset about a dentist who actually tells them all the issues in their mouth. Because obviously they are going through that second phase of grieving where they are thinking, oh my God, what type of dentist this is, who has all of a sudden, I saw a previous dentist, they never told me anything, what a good dentist they were, and this dentist all of a sudden. So please understand this, that they are actually angry and upset with their previous dentist. If you have actually shown them what is happening in their mouth and why they need that, once again, coming to the point of why, if you have shown them why they need the treatment, then they are actually upset with the previous dentist. But they are expressing it in front of you. So please remember that. Then the third part which is the depression. In other words, what the patients tend to do is they tend to disappear. Now the studies have shown that it is when you do a big consultation for a treatment and when you present a big treatment to the patient, big treatment plan to the patient, almost 90% of the patients don't get the treatment done straight away. 30% of them actually come back in a month. Another 30% will come back in 6 months. And the rest 30% actually come back in 12 to 24 months. This is essentially giving them the time to go through the denial, go through the anger, go through depression as in disappear. And now they are starting to accept. So before they accept, there is a step which is bargaining. which is actually usually what happens is it is almost always when they are bargaining, it is not just bargaining about the cost, it is bargaining about the problem. Where they are saying, hey doc, can I actually get away with 2 implants instead of 4 implants in the mouth? And you have to understand that this is where I'm trying to demystify this thought where patients think, oh my God, this is such a difficult patient. This is not a difficult patient if you understand their psychology at the moment. This is normal human behavior where they are actually bargaining the treatment with you because they don't want to go through that. And this is the time where you have to hold on to what you have said, because there is a reason why you have said that. If you have explained them the why properly, then there is a very, very good chance that they will accept the treatment. And obviously, look, it is acceptance and denial is interchangeable. And that brings us back to that 80-20 and that 100% acceptance. That it is possible that the patient, and remember that classification where I said, now you have converted your main intention. Please remember that the main purpose and intention of the consultation is converting the difficult patient into an easy patient. Okay? Like as I told in the beginning, if it's an easy patient but not wanting a treatment now, like they have gone through this whole phase, you have explained them everything you needed to, and they still don't want the treatment, that is absolutely fine. You don't have to treat everyone, right? But as long as you have done that part, I think you have done your job well. So this is very important. And this whole thing happens is when you actually prolong the process. So don't try to rush into it. Don't try to get them to commit to the treatment tomorrow or today in the chair itself. Because believe me, if you do that, you get away with it, you are lucky. Most of the times the patients complain about it. If you have put them in the chair and if you have done like 10 fillings in their mouth straight away, they don't complain about it at that time. But all these stages will come, believe me, and that will come post-treatment. So it will be very difficult for you to handle that then. You rather handle this before you have done any treatment, because you always have a chance of saying, okay, that's fine, we don't do the treatment. You rather face this before than after the treatment. Okay.